1 in 3 Americans has high blood pressure. That's 67 million people. There is an approach that works, and it's healthy. And Dr. Paula Walker-King is here to tell us about it.
Yes.
It's called the DASH diet.
It's called the DASH diet. And DASH is an acronym, stands for Dietary Approaches to Stop Hypertension.
And it works.
And it does work. And so literally, if you follow the diet plan, then literally you can see that top number, what's known as the systolic blood pressure, it can drop about 8 to 14 points over time. And so that lowers your health risk. So if we can get that top number down, that can be a major health benefit.
So how does it work?
Well, it's a diet that literally encourages us to lower our sodium intake to roughly about 1,500 milligrams, 2,300 milligrams. Want to keep it in that range. Then also you want to eat plenty of vegetables, fruits, grains. There is some allowance for poultry and fish within the diet, but you're keeping your alcohol consumption low, because alcohol tends to raise blood pressure, and you're keeping, most importantly, your sodium intake
Are
low.
you keeping the salt shaker out of reach too? Because there's your sodium too,
You
right?
gotta keep that salt shaker out of reach, because you know we tend to put too much salt in our foods, and so that brings me to this next tip, that you know when it comes to reducing sodium intake, you know you want to aim toward those foods that are labeled low sodium or sodium free, but also refrain from using additional salt once the food has been
That's
prepared.
an old habit, hard to break, I'm sure.
It is a hard habit. And then canned foods, for those of us that still use them, you want to rinse those vegetables off. So if it's green beans in a can, rinse those off to rinse some of that sodium away.
Good information. Thank you much.
You're welcome.
Dr. Paula Walker-King. Now here's